Welcome people. In this video we just want to peek into this general anesthesia chapter, general anesthetics, the pharmacology. So let us start. Definition of general anesthetics. These are the drugs that produce reversible loss. See this word, reversible loss. Okay, reversible loss of all sensation and consciousness. So you will be able to tell the definition of general anesthetics, right? Drugs used to produce reversible loss of sensation and consciousness. What are the cardinal features of general anesthesia? Loss of sensation, consciousness, loss of consciousness, immobility, muscle relaxation, abolition of somatic and autonomic reflexes. So reflexes are lost, consciousness is lost, sensation is lost, especially pain is lost, immobility, he can't move, loss of mobility you can say, muscles are relaxed, and abolition of reflexes. Okay, this is the only kind of different word if you want to put it like this. Got it right? So general anesthesia you have understood. When do they use general anesthesia? Before doing surgery. You know, no? Good. No single anesthetic agent can produce all the effects. So anesthesia protocol includes pre-anesthetic medication, induction of anesthesia, maintenance of the anesthesia, muscle relaxation, analgesia to reduce the pain, and other uses. Okay. But before all this, actually what they do, they go through the checks, chest x-ray and comorbidities, everything they check. All that has not been written here. Actually, they will evaluate the person for surgery. Evaluate for anesthesia. Look at the spelling. Anaesthesia. You can skip the extra A if you want, okay? So first they will evaluate. They will do a lot of checkups like chest x-ray. They will check the comorbidities, glucose level and all that, okay? So this they have not mentioned here. If you want, you can write that. So then pre-anesthetic medications are given like to reduce anxiety and all that. Induction usually they'll use this propofol. Propofol is used for induction. Very common it is. If propofol is not available, they'll use thiopentane. Thiopental sodium. Thiopental sodium is used if this propofol is not available. Okay. So that is for induction of anesthesia. Maintenance of anesthesia, they will use usually nitrous oxide plus isoflurane and halothane. We will come to all these drugs. Okay, just know this much. These are done as a protocol. Skeletal muscle relaxants, so many of the muscle relaxants. Like they usually, we have seen that they give this rocuronium. Okay, intermediate acting, neuromuscular junction, skeletal muscle relaxant. Okay, non-depolarizing muscle relaxant. Analgesia, they will give, what analgesics do you think they'll give? Some opioid they can give, opioid analgesics they can give. They can also give NSAIDs, okay. Other drugs they can use to reverse the block. To reverse the neuromuscular block, they can use to reverse the effects of opioids. They can use things, okay, and benzodiazepine. To reverse the effect of benzodiazepine, they will use this flumazenil, okay. That is a antidote kind of a thing for benzodiazepine, flumazenil, okay. To reverse everything you can use. So these are the, this is the protocol. Let's move on. How do general anesthetics actually act? The actual place of action is this reticular formation. Look at this. This reticular formation, right? Brain stem. So in reticular formation, these anesthetics will act, okay. This reticular formation is maintaining our consciousness. So even when you have to fall asleep, that moment where you fall asleep and you're awake, that is where reticular formation is responsible for that, okay. And most anesthetics, they depress this reticular formation, so you will become unconscious, correct? So it will enhance, these general anesthetics will enhance the inhibitory neurotransmitters, activity of these inhibitory neurotransmitters, and it will block the activity of excitatory neurotransmitters. Easy, no? Of excitatory transmitters. Easy? So, basically a mechanism of action is on the reticular formation. Increase the inhibitory action, reduce the excitatory action. Very good. Move on. So these are the stages of anesthesia. You should know these stages. See here, stage 1, stage 2, stage 3, stage 4. Stage 1 is analgesia. So the person will lose the pain sensation. Then you have stage 2, that is delirium. It is the stage of excitement actually. The patient loses consciousness, but his sympathetic activity increases. Okay, heart rate will be more, blood pressure will be more, pupil is dilated actually. And you can see here the respiration is irregular. Okay. In modern anesthesia, no, actually this delirium stage is very small, or it is like very inconspicuous. Okay. Another thing you can notice here, actually in this delirium stage, there is something called as roving eyeballs. The eyeball ocular movement, no, the roving of eyeballs is there. Okay. Then move on to surgical anesthesia. This is stage 3. In this, what happens? The breathing again has become regular till the end of at the end of this, actually what happens? The cessation of regular breathing. So what you can see here is this portion of it is called as the stage 3. In that there are 4 planes, 1, 2, 3, 4. Here if you look at the eyes, right, the roving of eyeballs is there in stage 1. Then after that there is only fixed eyes. 2, 3, 4 is fixed eyes. Okay. So there are 4 planes, guys. You should know this. The second plane, let us see, loss of corneal and laryngeal reflexes are lost. So here you can see the reflexes. Let me delete this. Here you can see in stage 3, you can see here the pharyngeal and corneal reflexes are lost in plane 2. Okay. In plane 3, light reflex is lost and the pupil again starts dilating. Stage 4, there is intercostal paralysis, shallow abdominal respiration and dilated pupil. You can see the pupil is dilated here. So here you can see what are the uses of all this. In delirium stage, nothing, it's not used for anything. But in surgical stage, what happens? Surgical operations are done in surgical anesthesia. That is in stage 1. Okay. Possibly in stage 2. Stage 1, stage 2 looks like they have written as surgical operations. Now let us move on to the 4th one, medullary paralysis. Here this breathing has stopped. You can see there is dilated pupil and it is actually widely dilated and the person can go into coma or death. Okay. So nobody actually wants to take you here. So don't worry. So here what happens in medullary paralysis, the muscles are totally flabby, pulse is thready, imperceptible and BP is very low. Okay. This much and all you don't need actually for your MBBS level. Let's move on, guys. So basically you understood, right? In stage, which stage they will do the surgery? They will do it in the 3rd stage of anesthesia. Okay. Which plane in the 3rd stage? Plane 1 and plane 2. Okay. Good. So what is the 4th stage called? Paralysis. What paralysis? Medullary paralysis. Very good. So now let's move on to the most important slide here. The general anesthetics, this is the pharmacology we are coming into now, the drugs, actual drugs and their names. Shall we continue in the next video? I think you have had a lot in this video. Come back for the next video. Let's just revise what we saw so far. Let's meet in the next video. Say bye.